Hi, I'm Dr. Angeline Yong and welcome back to another episode of Derm Detective, where we dive into real-life patient stories to unravel complex skin and hair mysteries. Today, we'll be solving the mystery of a patient who thought that she had a new acne eruption, but it turned out to be something very different. This patient, let's call her Cheryl, first came in to see me for concerns of new onset acne on her face. This was rather unusual for her as she always had clear skin, and she came back from an overseas trip recently noticing some red bumps on one side of her forehead. So she initially tried some home remedies and she went to the pharmacy to pick up some acne solutions to try to spot treat. However, after 2 to 3 days, as she noticed that it was getting more painful and a little bit irritated with maybe small bumps becoming tiny blisters, she decided to seek medical care. So when she came to see me, I noticed immediately that the bumps were interestingly only affecting one side of her forehead and noticeably not crossing the midline. On top of that, they were developing in clusters with new small lesions appearing on the eyelid. I told her that this is unusual and this is typically herpes zoster affecting one side of the face. So herpes zoster is also known as shingles, which is a reactivation of a childhood virus known as chickenpox or varicella zoster virus. After your first infection, the virus hides in the dorsal root ganglion, which is a segment of the nerve root, and actually stays dormant for many years. However, during times of stress, which can lead to lower immunity, this virus that has been lying dormant can reactivate down a particular nerve root. Hence, you will see that reactivation typically is preceded by signs of maybe itch, burning sensation before the rash even appears. After some time, these bumps may develop into fluid-filled blisters that may also become eroded, giving rise to a chance for secondary bacterial infection. This typically happens in older individuals above the age of 50, but is increasingly seen in younger individuals as well. Shingles isn't just a skin condition, it's actually a nerve condition with skin symptoms. And that is why early diagnosis is important, because early diagnosis gives rise to early intervention and early administration of appropriate medications. So we typically will use antiviral medications, and if started within the first 72 hours window, has the best chance of reducing overall lesion count and also disease severity. This can come with reduced scarring as well as reduced complications from a feared complication known as post-herpetic neuralgia. This is a terminology that we use to describe post-shingles pain that happens even for 2 to 3 months post-recovery. Patients can sometimes feel severe pain down the segment of the skin where the original shingles were. So how then did we treat Cheryl? First, I started her on a course of antiviral medications immediately upon diagnosis. I also started her on some pain relief medications. I typically will give topical acyclovir along with a topical antibiotic ointment as well, especially if there are already erosions and blisters to prevent bacteria from causing a secondary infection. I also give her advice to avoid close physical contact with individuals who might be immunosuppressed, such as pregnant women or older individuals, especially in light that her erosions were on an exposed area of the body. So Cheryl's skin lesions began to dry up and heal within 7 to 10 days after seeing me. It is important to note that we also have to monitor and treat any other complications such as scarring that might result from the herpes zoster or shingles infection. We can start various creams or topicals to lighten some of the scars at the right juncture when the skin is no longer irritated. There are also certain lasers that we can deploy at a later stage should there be a need to, such as the pulse dye laser or a resurfacing laser, largely to smoothen scars that may be indented. This case is again a good reminder that not all rashes are what they seem. So if you have an odd new rash that is affecting one half of your body or one side of the body, and this can be on the face, on the arm, leg or limb, seek early advice or intervention as it could be a sign of shingles. So if you like this episode, don't forget to like, comment and subscribe for more episodes of Derm Detective.